So at this time of year, it makes sense that what I would do is, as I look around and see everybody trying to find their self-help goals and fix what went wrong and take an inventory of what worked and what didn't, I can't help but wonder, why are we so obsessed with New Year's resolutions? And why do we feel the need to constantly improve ourselves? So when I looked it up, I found the origin of New Year's resolutions might have been an old Babylonian celebration that apparently lasted 12 days and involved making sacrifices and promises to the gods to right your wrongs and stick to your morals and get things right in the new year. In its evolution, New Year's resolutions have gone through multiple spiritual moments and movements and sort of evolved into what we now know them as today, which sometimes feels like just this constant need for self-improvement and find areas where we want to do better or make changes or quote unquote fix ourselves. I found this quote that said, "The new year offers a blank slate, an opportunity to get things right. So when we set New Year's resolutions, we use a very important concept called self-efficacy, which means that by virtue of an aspiring to a goal and following through on it, I have a sense of control over what's happening in my life." I hate that. I hate that that's what we think they are, because my experience personally and just watching and listening to everybody else around me is that in no way do New Year's resolutions make us feel like we have some sense of control over our lives. Usually, they're either a thing we think we're supposed to do or a thing that we do in some sort of desperation to try to make things better next year because we feel like things are going so wrong this year. In the best of times, there are these aspirational things that maybe put so much stress on us we don't even follow through after January. And at the worst of times, they're just here to make us feel bad about ourselves. I know way more people that are stressed out and shamed by New Year's resolutions than I do people who feel that they give them a sense of control over their life. That said, I do like the idea of New Year's being a blank slate and a time to reflect and maybe change course if it suits us. I hate thinking of it as getting it right, but I don't mind an excuse to stop and evaluate. In fact, I love any excuse I can to stop and evaluate. I just wonder, what if we think of this time, instead of getting it right or making the changes to fix ourselves, if we use this time to evaluate and figure out how we can take better care of ourselves. So I'm going to talk about self-care, which if you've spent any time with me, you know I actually hate the term. I'm going to use it today, though, because I think with some explanation, you might understand what it really means instead of what the capitalistic world has turned it into, which is a reason for TikTok shop. So what I found, again, Googling and thanks to AI, there's all this information out there that's at the tip of your fingers. And I do a little extra research to make sure it's proper information. But in this case, I didn't think there was anything harmful in this history. Meaning, the medical term for self-care came around about in the 1950s when the medical community itself started using it to describe long-term care for either the elderly or the mentally ill. Meaning, self-care was a way for patients to manage their own well-being or prevent ailments through exercise, good nutrition. In mental health, we talk about safety planning. If you have a heavy diagnosis, we talk about safety planning as a means of self-care. So that's where it started. In the 50s, self-care was literally what it said, a way to care for yourself to prevent worse things from happening. Then, during the civil rights movement, self-care became a kind of resistance. People of color, specifically women of color, started viewing self-care as a way to correct the failures of the white patriarchal medical system. So it was still medical in some way, but it was really a political statement to say, well, if you're not going to take care of us, we will do it for ourselves. Stinks that that's necessary, but that's where it came from. And now we sort of treat it as this multifaceted thing. Something called the Internal Self-Care Foundation created 7 pillars of self-care to recognize that self-care is, in fact, multifaceted. It's not just medical. It's not just a political statement. So those 7 pillars include mental health. They include physical health. They include emotional health, which I might argue emotional and mental are the same. But I'm not the organization that created these. So they're physical, mental, emotional, environmental, spiritual, recreational, and social. I love the inclusion of recreational and social because I think taking care of ourselves involves or should involve community. And recreational, it moves it away from just, I got to exercise instead of, I have to move my body. I have to use my body. I have to have fun. I have to have recreation in my life. And that could be hiking, or that could be competitive rugby, or that could be riding a horse, or that could be walking a dog. It's moving your body in a way that's fun and recreational. According to this same organization, some types include physical, social, mental, spiritual, and emotional. So basically they take their pillars and they add self-care to the end. And that's how you get the 7 types of self-care. So before I talk about how we can do this for ourselves, I want to tell you a little story, maybe a long story. In 2023, well, let me go back a little bit. I spent most of my 40s trying to find medical solutions for what was going on with my body that was uncomfortable on the best days and what was trapping me in the house on the worst days. It was a lot of pain. It was a lot of inconvenience. It was a lot of all kinds of things that just made me feel miserable most of the time. And every doctor took blood. And sometimes they would prescribe something. They would do tests. I had more pokes and prods and visions and pictures taken of me to all come back and say, we don't know what's wrong. You look fine. A couple things are off. Let's try this. And they'd give me a pill. And sometimes it would work for a little while. And then the thing would inevitably come back. And it just got worse and worse and worse until finally in 2022, I had a hysterectomy, almost total. I asked them to keep ovaries if I had them still intact. They went in, no promises being made, and said, if everything looks clean and we're good and there's no cancer or anything else, we're going to leave them, because I was 46, 7. I don't know. I can't do the math, but I wasn't 50 yet. I hadn't gone through menopause yet. And I thought, well, if I can keep my hormones intact with the ovaries as long as possible, then I would like to do that. My surgeon was incredible. I don't know where she was my whole life, because if I had found her 10 years earlier, I feel like maybe things might have been different, because she was the first doctor that I felt like looked at me and said, oh, I can see what's going on and we're going to take care of it. That had never happened before. Not only that, but she heard some of my what I would consider like outlandish requests, like, hey, I have a family history of cancer. And even though this surgery isn't for cancer, I'm very worried about getting cancer from surgery. Those are not things that can happen, friends. But I have this history of people who have surgery for something and then end up with cancer somewhere else. And so I was very concerned about that. And she looked right at me and said, oh yeah, we have a way to take care of that. That's not crazy to think. And it's not outlandish of you to ask. So we're going to do it this way instead. When I tell you that was the first time a doctor ever looked at me and said, you're not crazy, I'm not exaggerating. So the fact that she had a solution for a problem that I was worried that maybe I made up in my head was like otherworldly. Anyway, I really pinned a lot on this surgery. I thought for sure all of my problems would go away. I had gained a horrible amount of weight. And I say that not to like, this isn't like a fat shame body image thing. This is like, I was doing everything the same. And yet, when I say weight was coming on, we're talking upwards of like 70 to 80 pounds just happening to my body. And in the beginning, I was doing everything the same. I was doing everything right. I was still in a ton of pain and having a lot of problems. And so ultimately, by the end, I wasn't doing everything the same and everything quote unquote right, because I had no energy. I had no like iron in my blood. Had no ability really to do anything but the basic sort of life skills. Keep in mind, I was raising 3 children. I was finishing a doctorate degree and I had a full private practice. So it's not like I was laying home in bed. It's just that I didn't have anything left over for 5 miles on the treadmill or anything like that. And when I would go to doctors and say, I don't understand, I can't lose weight. I keep gaining it. I feel worse and worse. Now I have joint pain. In addition to these other things that were going on gynecologically, I now have joint pain and my head hurts and blah, blah, blah. And they would say, you should walk 5 minutes a day. Start at 5 minutes a day, and then you can work your way up. Okay, I just came in here and you told me my hemoglobin is at like 0. I have 0 iron in my blood. And you're telling me just start with 5 minutes a day. I could go on and on for all of the weird things that my doctor said to me. But the point is, I had pinned a lot on this hysterectomy. I thought, okay, I'm going to have this and then everything's going to change and I'm going to feel better and I'm going to stop being trapped in my house and I'm going to stop feeling miserable all the time and I'm going to get over the pain and all of the things and I'll be better and I'll be able to get back on track and I'll be able to lose weight. And that didn't happen. 2022 came and went. The surgery came and went. I recovered from the surgery. I started being able to walk again, like go for walks again, do some exercise again. My dog died. This sounds weird, but I'm going to tell you this anyway. My dog died during this time, and he was the dog that I walked all the time. We got a new puppy who's afraid of walks. So like some strange things like that happened that just changed the way my life was being lived. And so I was a little more sedentary, a little less. Even though I had some energy back, my body was still hurting. I still had joint pain. I still had all these things. Anyway, fast forward 2 more years as I go from doctor to doctor wondering why I can't lose weight, why I can't, get back on track, why I can't feel better. Like I just accepted, okay, I guess this is who I am. I'm pushing 50. I think I'm just going to be this way at 50. So come to the end of 2023. And I had been passing the construction for this gym / like I think they call it like an athletic country club or something. It's a fancy gym, but calling it a gym doesn't feel like enough. There's everything in it. There's everything. There's pools, there's pickleball, there's Pilates, there's everything is in this place. And I would pass by it every single day on my way to and from different appointments. And I would say to myself, I'm going to join that one day. And then I would immediately say to myself, no, you're not. It's going to be ridiculously expensive and you don't even go to a gym. Who do you think you are that you're going to join this place? And this is a pod and a video for another day where we talk about that evolution of becoming the person who actually joins that gym. We'll put a pin in that part of the story. Just know that I did join it. It finally opened in February of 2023. At the end of December, I had already joined knowing it was going to open. And so I sat with myself and did this inventory of what's been working. What do I want differently? What do I want to keep the same? Which I've started to do every year now for about 5 or 6 years. In lieu of New Year's resolutions, I do this sort of inventory of my life and what I want to be the same and different. And in this year, last year, I thought I'm going to move my body more. I'm going to join this thing and I'm going to, find a thing that makes me happy. At that time, I thought it was going to be the pools. I thought, oh my gosh, finally it has pools in it. I can swim whenever I feel like swimming because it had more than one pool. So I wasn't going to have to compete with swim team or swim lessons or anything like that. So in the beginning, I thought, okay, I'm going to join this place and I'm going to swim and I'm going to move my body more. And I worked out my schedule so that I could go to the pool more, all these things. So in February, it opens. I start going. I'm pretty consistent about it. I join some classes. I start doing Pilates. I start doing pickleball. I'm active again. And I feel more like myself than I have in 10 years at this point. And I think, oh my gosh, I'm pushing 50. And yet I feel like my teenage self who was this active, athletic human. And not only did I not lose a single pound, I was gaining weight still. And so it's hard. It's hard to eat well when you don't feel like anything's working anymore. I thought, I'm so confused. I don't know what's right. Is it no carbs? Is it more protein? Is it this? Is it that? I went to school for nutrition. I understand the basic building blocks of a healthy diet, and yet I could not feel healthy. I felt better at the gym because I was going and active and moving my body in ways that I didn't even know I could do anymore. And so that felt great, but I still just wasn't like, not only did I not like the way I looked, I just didn't feel like the physical shape of me fit how I felt inside. So a funny thing happened. One of my trainers said to me, have you ever considered breast reduction surgery? And I said, yeah, all the time. Like for like 20 years of my life, I've wished I could get breast reduction surgery. And then I listed all the reasons why I thought that wasn't a thing for me. And then that was it. I dismissed it and I didn't think of it again. And then I saw a thing on a Facebook group, a like local neighborhood Facebook group where you ask for recommendations and, you talk about what's around. And somebody said on the Facebook group, does anybody know a good breast reduction surgeon for teenagers? What? I was like, I'm sorry, teenagers? Like teenagers can get breast reduction surgery? I was floored because if you can't see me and you've never seen me, if you're just listening to this and you don't watch, I have been blessed with, mammary tissue since I was in the 6th grade. In fact, I was even on an episode of the Today Show when it used to be Hoda and Kathy Lee made a comment about how blessed I was. So my boobs were famous, people. Kathy Lee even commented on how big they were. So when you think about that person hearing that teenagers are allowed to get breast reduction surgery, I almost fainted at the thought. But what it did was it sent me down the rabbit hole. More than one somebody like enthusiastically recommended this doctor. And so I kind of went to check her out online, like, my mind blown. I was like, who is this woman? And lucky for me, it is a woman who has a wonderful social media presence. She's a kick-ass surgeon. But in those early days, I didn't know that. I just knew she was everywhere. She was on TikTok. She was on Instagram. She was on Instagram and TikTok talking a lot about breast reduction surgery. She does a whole bunch of other things. She does all kinds of other plastic surgeries, but she's very women focused and she's very women empowerment focused. And she's very focused on helping you feel good in your body. And I thought, well, I could get down with that. I could be down with somebody who wants to help me feel good in my body, because I think I'm doing everything I'm supposed to be doing in order to feel good in my body. And I don't feel good in my body. Anyway, you guys might think the story's over, but there's more to it. So I go to an appointment with her. I say to my husband, I think I'm going to try to have breast reduction surgery. And he's like, okay, you've been talking about it since I've known you. So great. I was like, I don't know. I'm going to go to this appointment. I'm going to see what she says. She's probably going to tell me I have to lose weight. She's probably going to tell me I can't have it for whatever reason. Whatever. I go in, she takes one look at me and goes, yeah, this is not going to be a problem. I'm sure insurance will pay for it. You know, you've got back pain. Oh, by the way, which is all true. I've got back pain. I've got shoulder pain. I have a pinched nerve in my neck from wearing a bra. Like, no issues getting this medically necessary surgery. She goes, we schedule it. We get on the books. I'm all excited. I keep working out. I keep doing the things because now I'm like, all right, now I want to lose weight because I want to make sure I'm down before I get into the surgery. Nothing happens, by the way. I'm still working out. I'm working on even more and nothing happens. We get about 2 weeks out from the surgery and I go, maybe 3 weeks out from the surgery, and I go for two things happen. One, I make an appointment with a gynecologist who is like menopause focused. Out of pocket, you got to pay her, you got to pay cash, like the whole nine. I recognize how lucky I am to be able to do this. And also at the same time, I'm pretty much working in order to pay for all this stuff. So it's not total, easy. It's not totally easy. So one, I make that appointment. Two, I go and do all my pre-op blood work and appointments for the surgery. The blood work from surgery, I submit to the surgeon, not thinking anything of it. Everything looks okay as far as I'm concerned. She writes back and says, we canceled your surgery. Sorry, not even the surgeon. The nurse writes back and says, we've had to cancel your surgery. Your A1C is too high. I'm like, what? So my family, we have a history of diabetes. My father had it. A couple of my siblings have it. Doesn't matter. It's not weight related. There's all the shame and stigma around diabetes. And there shouldn't be, because some people just get it, whether they do everything right or everything wrong. However, I will admit to you that I fell for the shame and stigma of diabetes. And I thought I could keep myself from getting it. I thought I could keep myself out of this danger zone if I just do all the things right. If I eat, if I exercise, if I stop drinking, if I do all the, no sugar, all of these things. And then this surgeon comes back to me and says, your A1C is too high for us to do the surgery that you really want. And I thought, honest to goodness, my very first thought was, your fat ass isn't allowed to do this thing because you're so gross and you're so overweight that you're diabetic now. For those of you who don't know what A1C is, it's basically a measurement of sugar in your red blood cells. They take it over 3 months. There's a range that's quote unquote normal. I was the lowest number in the range that is considered pre-diabetic. But for elective plastic surgery, that was too high because it affects the way you heal. Your scarring can be worse. Your bleeding can be worse. And so the surgeon's like, I'm not doing surgery on somebody who might bleed, especially elective surgery. Because a couple of my sisters who have higher A1Cs than me were like, wait, I had surgery and whatever. I had a hysterectomy with the same A1C, but that's not as, it's not elective, first of all. And also it's not, the risk of bleeding is just different. So yes, there was I probably could have shopped around and found another surgeon who would have done it anyway, but that wasn't what I was trying to do. And I took it more as after I got over the initial self-punishment of like, hey, fatty, you're not allowed to do anything because you're fat and you're gross and you're lazy, which was all the things I was saying to myself. I fairly quickly got over that. On my like 4th class at the gym for the week, I realized like, you are none of those things, fat, lazy, or gross. And said to the surgeon, okay, What do I need to do? What does the number need to be? What do I need to do? And at the same time, went to my GYN and said, hey, they just canceled this surgery because they say my A1C went too high. And she was like, also, I don't think it's too high, but I don't like it. And I think with your family history, we need to do something to get it under control. So we did. After years of fighting medicine that I thought made me diabetic, I finally agreed to be like, I'll take whatever you tell me to take. I have been trying everything on my own and nothing is happening. And she said, yeah, of course it's not. Your metabolism is completely out of whack because you've had all this body trauma, you've had all these surgeries, you've had, this hysterectomy. So your hormones are all over the place. That messes with your metabolism. She gave me like a lot of wonderful explanations for why I was where I was, and not one of them included me being fat or lazy. And that was a real relief. And I finally realized, oh my gosh, I have spent 10 years blaming myself for things that were beyond my control, somewhat because doctors were telling me, I don't know what to do for you. I guess you could walk farther. And somewhat just because I was predispositioned to think it was all my fault. It was all my doing. It was all my responsibility. So 1 week, I think, 1 week on this medication. It was a couple different things, one including a GLP-1. There was a GLP-1 involved in there. For those of you who don't know what that is, it's an Ozempic, Wegovy. Mine was Wegovy. The lowest possible dose. In fact, we had to fight my insurance to get them to agree to the lowest possible dose because whatever, they have a whole protocol. Again, that's an issue for another day. Insurance deciding what your medical care needs to be. But anyway, a week, not even, maybe a couple days before even starting the GLP-1, I was on a couple different other pills that helped with inflammation and metabolism. And I was walking through the grocery store and Trader Joe's. So for those of you who know, Trader Joe's is a wonderland of food that is delicious and bad. I try not to call foods bad anymore, but it's chocolate cookies, it's, caramel popcorn. It's like sugar, 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 sugar. Or carbs, 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 all of which are delicious. I'm walking through the Trader Joe's and for the first time in my life, I think, I go, I don't want anything. Like, I'm not like, my mouth's not watering. My brain's not thinking about what I need to go. Where are the cookies? Where are the Trader Joe's? Why don't they sell my JoJo's chocolate covered peanut butter JoJo's anymore? There was none of that there. I later learned that something called food noise and the GLP-1s supposedly take care of that. I didn't even need the GLP-1s. Just the medicine that was helping my metabolism took care of that instantly. For the first time in, if not my life, then in like 10 years, I wasn't sort of constantly thinking about food. Anyway, fast forward 6 months. I was supposed to have surgery in August. It got postponed in like July. I started all that medication in July. My A1C was still too high. So they canceled the August surgery. They rebooked it I made them rebook it. I said, please put me on the calendar because I don't. So actually, no, what they did was they rebooked me for an appointment, a follow-up appointment in August, 1 month. I was like, you canceled it in July. I want to come in at the end of August and I want to get myself on the calendar before the new year. And they were like, great. We have all your approvals last until December. So we can get you on the calendar before December. So in 1 month, without that food noise, I was still doing all the same workouts. I actually added a couple Pilates things to my workouts. I was going to yoga. I was still working full time. I was still eating regular food. I didn't, there was no like calorie restriction or anything like that. What I was able to do was like quiet down the cravings for sugar and alcohol and all the things that make you feel good in the moment. I really drastically reduced carbohydrate intake in that month just because I was committed to this A1C thing. And sure enough, I got blood work again about a month and a half later, not even 3 months, which is what it's supposed to take, but 2 months later. And it was low enough for them to book my surgery. And then I had the surgery. And I realize now, looking back on last year's goal to take care of myself more, what that ended up looking like for me was being kinder to myself, being more open to medical intervention as a solution instead of as some sort of admittance of failure. Understanding sometimes your genes are just going to make you have a propensity for these things, no matter how well you eat or how much you exercise or how you do the things you do. Also, it meant being persistent in my efforts to find people who listen to me. The surgeon, well, My surgeon is a total badass, but really her nurses are the ones that listen and are kind, and the follow-up's been amazing and all of that. She's just a badass who I was like, yep, I will let you cut into me because I trust that you're going to do a bang up job. And then the nursing staff and everybody else that's involved in her practice is just kind and nurturing and lovely. So finding that, but having her look at me and be like, yeah, this is going to be a big deal for you. Like, A, you deserve to feel good, and B, I can make that happen. I can give you what you need in order to feel good, and you deserve to feel good. That was sort of her thing. Like, why wouldn't you have this surgery? Don't you deserve to live the next 30 years of your life, pain free? So having her, and then the GYN that I go to, having her be like, one, you're not crazy. These things that you're experiencing, this pain you're having, this brain fog, waking up every morning with your hips hurting, like all those things are real. They're really happening to you. It's not your fault that you can't lose weight. I see that you're doing everything right, and I want to help you. I want to help those things happen. Like, they should matter, and they're not mattering right now. So let's make it so that they matter. Having her hear me and validate me and tell me that I'm not crazy for feeling this way, and that yes, there is a way out of it, and that it's not my fault. It's not something I did or didn't do. That was life-changing. It allowed me to expect that from now on, not only from medical professionals, but from myself, to expect from myself this level of care, of understanding, of grace, of saying, this isn't your fault. You don't deserve to feel this way. So how can we make it better? It allowed me to invest in myself. If 10 years ago me had seen what I pay for this gym membership, they would never have believed it. And yet it feels like a wise investment because it's keeping me healthy. It's keeping me engaged in the process of being healthy. I've recognized that not everybody has access. I didn't have access to stuff like this years ago. So I understand that it's not possible for everybody, but it is possible for me, and I'm doing it, and I feel okay about it. I'm not going to feel guilty about it. So I've lost a ton of weight. Some, I'm sure, because of the GLP-1s, but I'm constantly checking in with her to make sure that it's not going to just all come back. And she's like, you're not even on a dose high enough for it to matter that much. Like, your metabolism is getting sorted. And because of that, then you're going to be able to sustain this when you're off. I'm almost done. I've taken them for a few months. I stopped taking them for a while because of the surgery. There's been an up and down. We've been fighting with insurance. There's been a lot of back and forth. And so my doctor said to me, like, you can't give the credit to the GLP-1s entirely because you haven't even been taking them for half of this time. So once we got my metabolism right with some of the other tweaks and medications, and I was continuing to do everything I was doing, eating well, exercising, moving my body, getting rest, all those things, it was like that was the magic combination. So I was first doing all the things. Then she gave me a couple of these medicines that were like, oh, I'm going to tell your body what to do. And now your body's going to start doing it. Poof, the weight starts coming off. I have this surgery where I lost 10 pounds from the surgery. And now I get to live in this body that does all of these amazing things. Even at my advanced age of 50, it does all of these amazing things. And so I have learned the value of taking care of myself, of doing what I need to do to feel better, of loving myself in a way that isn't just emotional. It's not just trying to convince myself like I used to, that like, I'm so grateful for this body. I love this body. It can do anything, even though I don't love the way it looks. I don't like the way I feel. And it takes a lot of effort. I still kept trying to convince myself, love myself, love myself, love myself, just by being human, which isn't a bad thing. But I've also learned that part of loving myself is demanding that I get what I deserve when it comes to feeling better and being active. I have never spent this much time taking care of me. Even when I was young and didn't have kids, I didn't spend this much time taking care of me, largely because when you're young, you just take for granted your health and wellness anyway, and you go live your life. The difference also is that not only have I not spent this much time, but I have never been so kind to myself. Because even in the days where I was exercising like crazy and eating well, quote unquote, none of it was good. It wasn't fun. I was racing from one thing to the other, and I was doing it all so that I could fit into a certain pair of jeans. But now I'm doing it because I want to spend the next 30 years of my life active. I want to feel good when I wake up in the morning. There's always going to be things. Aging is aging, right? But I want this body to be functional for a good long time. And in order to do that, I have to love it. and I have to take care of it and I have to nurture it and I have to give it what it needs. And it's been kind of nice this year. So my resolution, or whatever you want to call it, my promise to myself next year is to continue that loving myself, but no longer just sort of the basic care, the basic, care and feeding of me, but instead step it up a level to figure out what feels good in this body and what brings me joy. Because if I deserve to feel good, don't I deserve to have some joy? But I have to be able to identify it first. So that's my resolution, is find the things that bring me joy and get more of them into my life. So here's what I would suggest to you. First, that basic inventory. What went well last year? What didn't? What do I want more of? What do I want less of? What do I want to keep the same? And what might I want to change? Tune in. Give yourself some time, whether it's 10 minutes or an hour or a day. Isn't that glorious? When your kids are older, it gets to be a day and it's so lovely. If you love a big whiteboard, if you love Post-its, those big Post-it posters that you can stick on your wall, if you just want a notebook or a journal or a notes app on your phone, make those lists for yourself. What was good? What do I want to be different? What do I want more of? What do I want less of? Tune in and take that inventory. And then find somebody who listens to you, whether it's a medical professional, a therapist, a friend, a colleague, a partner. Find someone who listens to you, and don't be afraid to be stubborn about finding the right person. I really thought that I just had to take what my doctor said and figure out what to do with it on my own. And then I just decided I'm not really willing to do that anymore. I need to go find someone who's going to... Once I had that first surgeon who did my hysterectomy, who really listened to me and really validated my concerns, I thought, oh, this is a thing I'm able to access. I'm going to be really stubborn about finding that person. Does it suck that I have to pay out of pocket? Yes. Is it totally unfair that we have to pay out of pocket for good healthcare sometimes? Absolutely. That's a problem for another day. For right now, find someone who listens to you. It could be for free, and be stubborn about finding them. You deserve it. And then try to do what feels good to you without the outside noise. Tune out everybody who tells you what you should or could or what's safe or unsafe. There's nothing that drives me more bonkers right now than all of the people on the internet telling you what's safe and unsafe in your foods. Again, a podcast for another day. But do what feels good without the outside noise. Listen to you for that one. Because self-care can be all of those things: medical, emotional, mental, physical, recreational, social, and it can also be self-love. So let's try to love ourselves more in the next year. Instead of resolving to fix, let's resolve to love. Thanks for listening. Until I see you next time, stay curious.